The government of Guyana, in its effort to improve the well-being of Guyanese, has allocated 12.5% or $31.2 billion of the 2017 national budget for the advancement of the public health sector. The equipping and upgrading of district hospitals will see the delivery of a full suite of mandated services. This will allow the provision of inclusive health care to citizens. Key areas of focus for government include preventative health care, new treatment care, care for the elderly, eye and oral health, and disability and rehabilitative services. I'm your host, Gabriella Patram, and this is Guyana's 411. In evaluating Guyana's progress towards achieving the Millennium Development Goals, it has been recognized through the MDG Acceleration framework that there is need to improve maternal health. With success in immunization and preventative health care, the ministry is working towards strengthening its expanded program on immunization and nutrition. This program is regarded as the gateway to eliminating infectious diseases in children, which are contagious. The program also provides a greater number of opportunities to deliver necessary nutrients and anti-disease medicines, preventing outbreaks and death. More extensively, the Maternal and Child Health Department, which has the responsibility of executing the program, is working towards improving its services. Training and capacity building of healthcare workers and staff attached to this department will commence as citizens obtain maximum health care, which is necessary for growth and development. The framework has identified 5 bottlenecks to pure maternal and child health and extends solutions that will guide intervention to address the issue. The Ministry of Public Health Maternal and Child Health Department is tasked with ensuring that women, children, and family members obtain maximum health care that is necessary for their growth and development. The development is expected to continue to be developed through a number of capacity-building exercises for its staff and health workers. Additionally, a number of other programs are expected to be rolled out in various regions, as well as the development of community plans to support women and children.
To supplement the ongoing work of the MCH unit, the initiative Support to Improve Maternal Child Health will come online in the new year with the support of a development partner. Upon successful implementation, this $8 million project will contribute to the reduction of maternal, perinatal, and neonatal deaths in Guyana by 1. Strengthening the primary level of care for health services in regions 3, 4, and 9. 2. Improving the supply chain for contraceptive methods, drugs, and blood products. 3. Strengthening of the maternity waiting home strategy, including the development of individual and community plans to support women and newborns. 4. Improving health information. 5. Training of health workers in the regions previously stated. And 6. Strengthening the capacity of the MCH unit.
Guyana has made progress in improving maternal health but still faces significant challenges in meeting the MDG and its associated targets. The situation analysis and the identification of bottlenecks and solutions carried out by the Global Policy Forum has resulted in the drafting of a country action plan which comprises activities aimed at ensuring the success of interventions in the maternal health sector. The plan also identifies the resource gaps currently faced by the government of Guyana in its efforts to improve mothers' well-being.
In 2016, $88.7 million was spent on the extension of the maternity block of the GPHC. And in 2017, $11.8 million is budgeted as a retention project for same. This block will provide a 50-patient bed, and it consists of 2 floors. On the ground floor, there are training rooms, there are doctors and resident on-call rooms and offices. On the first floor, there are 2 operating theaters, birthing room area, post-delivery room area, and a step-down unit along with a neonatal intensive care unit.
In relation to children and their health, the Public Health Ministry has developed a robust vaccination program which ensures that 100% of all babies born receive necessary vaccinations so as to prevent disease and infections. The expanded program on immunization EPI is one of the ministry's most robust programs. The ministry has been able to achieve a vaccination coverage of over 90% of all antigens given to the under age 5 population.
The vaccination program measures the coverage on a continuous basis, and as such, the statistics given is for 75%, which is the third quarter of this year's estimated births. It is impossible to be able to give an annual coverage when we have only covered 3/4 of the year and compare it to the year before. Mr. Speaker, the coverage being measured out is measured out of 75%. In other words, in this year's budget, the 1-year-old immunized against TB and BCG shows that it is 75%. But because it's only in the third quarter, that 75% is actually equal to 100%. If at the end of the year you compare it, it will be 100%. Because it's the third quarter, Mr. Speaker. Likewise, for the DPT pentavalent, the 73% is 73% out of 75, which is an excellent coverage. To date, the immunization has maintained a vaccination coverage of over 90% for all antigens. Currently, for the third quarter, the coverage is the following. PCV13, 65%, MMR, 69%, polio, 70%, Haemophilus influenza, 73%, hepatitis B, 73%, DPT, 73%.
In September, the World Health Organization, WHO, declared the region of the Americas free of measles and rubella, commonly known as mumps. The region was the first to have eliminated measles. Measles is a viral disease that can cause severe health problems, including pneumonia, brain swelling, and even death. Guyana has successfully received certification for the elimination of measles and rubella through a successful and effective vaccination program. Efforts are currently on the way to eliminate the wild polio virus too, after successfully implementing the injectable polio vaccine IPV and switching from trivalent oral polio to bivalent oral polio vaccine.
Among the 2016 achievement of Maternal and Child Health Department is the successful completion of the switch from trivalent oral polio vaccine to the bivalent oral polio vaccine as part of the regional endgame strategy for the eradication of wild polio virus type 2. There was an outbreak of diphtheria in neighboring Venezuela in October, but Guyana was able to prevent a cross-border outbreak. Outreach activities as well as on-spot surveillance training for health workers were conducted in regions 1, 7, 8, and 9, and some 1,262 doses of the vaccine against diphtheria were administered.
An outbreak of chickenpox in Region 8 was quickly contained. Nursery and primary school children as well as community members were vaccinated. Even with such a robust vaccination program, the MCH department still utilizes other opportunities to increase its vaccination coverage across the country. One example is the observance of Vaccination Week in the Americas 2016, where mop-up campaigns were conducted. Some 13,867 doses of various vaccines were administered during the period. In 2016, children in all orphanages in regions 3, 4, 5, and 10 were administered the varicella vaccine. In 2016, yellow fever vaccine supplied to the general public for traveling purposes increased due to the yellow fever outbreak in Angola. However, with the assistance from PAHO, WHO, the ministry was able to effectively manage this situation. With Guyana achieving more than 90% of vaccination coverage, efforts continue to maintain and improve the cold chain system with the procurement of additional refrigerators. Additionally, persons administering these vaccines will undergo continuous vaccination and capacity building training. In 2016, 111 healthcare providers were trained in effective vaccine management. 102 received training in vaccine-preventable disease surveillance and training in regions 2, 6, 7, 8, and 9 and on new vaccines countrywide. However, this 2016 vaccination program was not without challenges. It faced inadequate human resources within the hinterland for program execution, delays in the arrival of vaccines, and lack of financial support for execution of routine immunization activities. The free dental and eye care services offered to Guyanese cannot be overemphasized. 2017 will see the effective and efficient delivery of these services that have been strengthened through partnerships fostered in the past years. While international and Caribbean counterparts continue to lend their support to the health system through volunteer services, the government of Guyana continually works towards ensuring that local doctors are trained and specialize in these fields as well. Diabetic retinopathy has been recognized as the leading cause of blindness in Guyana. Uncontrolled diabetes resulting in high blood glucose levels for extended period blocks off the small blood vessels, which eventually leads to blindness. The Georgetown Public Hospital Corporation and the Ministry of Public Health collaborated with the World Diabetes Foundation, Orbis International, University of Toronto, resulting in the establishment of a diabetic retinopathy program at the GPHC. Ophthalmologist at the GPHC, Dr. Celeste Hines, says that the program for detecting diabetic retinopathy is being improved.
The Guyana Diabetic Retinopathy program was introduced for the first time, is introducing for the first time easy access, right, for our diabetic community to be screened and checked for diabetic illness in the eyes. So how do we go about doing this? All right, so through the project, one of our main donors, the World Diabetes Foundation, has helped us to procure some very expensive retinal cameras and other ophthalmological instruments, which will now help us to fast-track the screening process.
The doctor adds that this upgrade will foster time efficiency while at the same time ensure persons seeking the services will be attended to and treated effectively.
Instead of having to go through a long eye exam with your ophthalmologist, you come, you get an appointment, you get dilated, you get examined. This would be much more fast-tracked in a much more modern way. So we have these retinal cameras at the clinic, which will take a digital picture of the eye, of the retina of the eye, because of course that's the part that's damaged. The retina, that photo will now be analyzed by eye care professionals, and they will grade your diabetic retinopathy, how bad it is. And depending on that, we'll offer a line of treatment.
Eye surgery to correct any detected and diagnosed case of diabetic retinopathy is made available to Guyanese free of cost. Early detection of symptoms of the disease would enable persons to benefit from key treatment, which would prevent possible need for surgery. Services of this kind are usually costly. Former Health Minister Dr. George Norton says that Guyanese must count this service as a privilege.
We take things for granted. In the small islands in the Caribbean, every cataract surgery that is done, they have to pay 400 EC dollars. In Bascom Palmer in Miami, to do a phacoemulsification with intraocular lens implantation, foldable lens and so on, minimum 3,000 US dollars. If any one of you here have cataracts, Dr. Hines will take you down to the Georgetown Public Hospital, and with a little bit of adjustment, she can have your surgery done Monday morning or even later today at no cost to you. I am pleased to see that diabetic retinopathy program is already well established at the Georgetown Public Hospital Corporation, and that was launched in June of 2016 with the objective to screen 16,000 patients living with diabetes, of which 10% of that amount will have to undergo treatment for diabetic retinopathy.
Other free eye care services and surgeries were made possible through a number of volunteer international and Caribbean agencies and non-governmental organizations coordinated by the International Desk at the Ministry of Public Health. The value of foreign aid received through the International Desk in 2016 was in excess of US $1.3 million. Resources donated included medical equipment, medicine, medical supplies, and educational material and aid. Free eye screening is done at the GPHC, while the Cuban Medical Brigade offers services at the Ophthalmology Center in Port Morant, Berbice. Conversely, dental services offered to the Guyanese citizens have improved significantly. Within the public health system, there are 59 dentists, dental nurses, 21 community dental therapists, and 23 dental assistants. There are currently 13 graduates from the University of Guyana School of Dentistry working in the public health system. Minister Cummins outlines dental programs undertaken by the Public Health Ministry.
The dentists and the community dental therapists are trained particularly to attend school to school children and young adults below 18. They work primarily under supervision of the dental surgeons to impart oral care to children generally and visit schools in their vicinity to deliver preventative and curative dental care.
14 dentists and 4 dental assistants graduated from the batch trained within the last 2 years. Another round of training will begin in 2017 for these 2 categories of health workers. The most active regions participating in this training are regions 3, 4, 6, and Georgetown. This program is being partly implemented in other regions due to constraints such as lack of enough mobile dental equipment. Training and capacity building exercises for dental specialists and doctors will result in enhanced dental services. This is part of the Public Health Ministry's mandate as highlighted by Junior Public Health Minister.
There are 72 dental surgeons in Guyana and specialists. This number includes 4 specialists, 2 maxillofacial surgeons, 1 prosthodontist, 1 orthodontist. There are 35 private dentists practicing locally and 30 within the public health system. As we move into 2017, the Ministry of Public Health will continue to work assiduously to further enhance the dental health services currently offered within the public health system. This ministry will be embarking on ways to ensure and to provide access to better quality professional oral health care for those vulnerable populations in Guyana. Additionally, the ministry will provide service and education to children, since we believe that practicing an effective oral health should begin very early in a person's life.
Meanwhile, the Ministry of Public Health, through the Chedijagan Dental Center, continues to offer exemplary dental health care services to citizens. A broad spectrum of dental health services, including dental surgery, is offered at the center, utilizing the best modern technologies. Approximately 90% of the Guyanese population has access to the dental health services offered by the Ministry of Public Health. The Chedijagan Dental Center now offers specialized dental care in a number of areas, including periodontics, which is gum disease surgery, and endodontics, which is a root canal therapy. With major accomplishments in 2016, there is expected to be direct spin-off benefits for a number of people. With growing demands for specialized care in several areas, the Ministry of Public Health, through various regional and district hospitals, is moving to provide these specialist services at little or no cost to the public. The GPHC is the main referral hospital. Hence, serious and complex cases needing urgent medical attention are referred to the institution. Even as the government is moving towards equipping all the regional hospitals with specialized equipment and specialist medical personnel, there is still need to strengthen the main referral institution. Former Minister of Health, Dr. George Norton, notes that cardiac care services, among others, will be offered to Guyanese citizens free of charge at the GPHC.
In this House, there have been much complaint about the Georgetown Public Hospital, especially the Accident and Emergency Unit, complaining of the long hours patients have to wait, the hospital, the A&E unit being overcrowded, and no beds for admitted patients. Mr. Speaker, hindsight that I must always remind the honorable member is always 2020. But the House must be informed that the Georgetown Public Hospital Corporation provides the highest level of care within the government-owned and operated healthcare system. This hospital has been undergoing a transformation to better meet its mandate. Its capacity for higher quality and complex care has increased significantly in all the major specialties. It has an expanded program for cardiac care, including invasive cardiology and open heart surgery. Also, there are joint replacement and spinal surgeries, renal replacement program, including renal transplant, enhanced oncology, enhanced neonatal and pediatric programs, along with obstetrics and gynecology.
In December, the first public cardiac intensive care unit in the Caribbean was commissioned. Services offered at the facility will be free of cost, while cases requiring surgery are facilitated by the Caribbean Heart Institute. Costs for these surgeries will be subsidized by the government. Minister Norton indicates that the opening of the unit is a pivotal step in decreasing the number of cardiovascular disease-related deaths.
GPHC spent $10 million to complete the cardiac intensive care unit together with the Guyana program for advanced cardiac care. This has the capacity for 14 beds for the management of persons in need of critical care. The cardiology unit at the Georgetown Public Hospital will now be able to provide cardiology service to citizens who otherwise would not be able to afford these services.
More extensively, in 2017, $45 million will be spent on the new treatment care center towards the continued improvement of the diagnostic capabilities for laboratory, pathology, and imaging operations at the GPHC. The former Minister of Public Health states that the millions of dollars will go towards purchasing of specialized medical equipment.
For medical equipment, 63 patient monitors, ventilators, defibrillators, instruments and equipment for thoracic surgery, digital mammography system, pathology equipment, radiology equipment, ENT equipment, pediatric equipment, neurosurgery equipment, neurology equipment. All of this have been budgeted in this 2017 budget. And in keeping with the government's green agenda, $4 million has been allocated towards replacing all security lights with LED lighting within the compound of the GPHC.
Aging is associated with many forms of disabilities because the older a person becomes, the higher probability of exhaustion, physical, mental, or emotional illness, poor health, or poor fitness. A population is considered to be old or aging when the proportion of the population aged 65 and over exceeds 8 to 10%. The distribution of Guyanese elderly population stood at 31,716 as of 2002. Based on this, government has focused heavily on specialized care for the elderly. In the Finance Minister's Budget 2017 speech, care for the elderly is clearly outlined along with what can be expected for the year.
Care for the elderly has suffered from a number of setbacks, including the inability to attract and retain committed resources, limited ownership from families to assist in the general care and welfare of the elderly, and poor management. In the new dispensation, elderly citizens can expect to benefit from improved care through the implementation of minimum standards which seek to provide modern institutions for them. It is envisaged that these standards will be elevated to ensure that elderly persons are respected, treated fairly and with dignity, live productive lives, and are in constant contact with loved ones. In addition, our senior citizens residential facility will benefit from substantial repairs to the tune of $89.5 million in the new year.
Former Social Protection Minister Waldo Lawrence gave an overview of interventions in 2016 to complement elderly care in the public health system. There is expected to be greater emphasis on enhancing the care offered to our elderly citizens by modernizing the main care facility, the PAMS.
In 2016, several initiatives were implemented at the PAMS facility. 2 doctors assumed duties to provide round-the-clock medical service to the residents of the Palms, night shelter, and other homes for the elderly. In addition, an infirmary will soon be commissioned to provide on-site medical treatment for residents. In 2017, nurses will be deployed to implement the service rendered by the 2 doctors in the infirmary and on wards, as well as off-site treatment. Further, lifts will be installed in the institution to help move patients' laundry, food, and utensils. With regard to the building of the modern facility, discussions with the Islamic Bank are expected to continue so that works on this new facility can begin.
The care for the elderly offered in the public health system will improve over time in collaboration with other government agencies. As the government continues to work towards ensuring that Guyanese are among the healthiest persons in the Caribbean by 2020, the elderly is in no way excluded. The Disability and Rehabilitation Services Program of the Ministry of Public Health is set to deliver new and improved services in 2017. A total of $21.8 million was budgeted as capital expenditure for this program. This program is aimed at enabling disabled persons to achieve a greater level of independence and participation in society. With the reform of the Disability Commission and the establishment of a training center, psychotherapists are to become even more familiar with care for persons with disabilities. The Disability and Rehabilitative Service of the Ministry are to provide services for all persons with impairments and disabilities, thus creating an environment for persons with a disability to socialize and play an integral role in society. Minister Cummins explains that what can be expected under the Program of Disability and Rehabilitation Services for 2017.
We are going to form a commission, Disability Commission. There is one, and so we're going to we won't resuscitate, but we want to put some, continue what they're doing. Of course, you know, we have at the University of Guyana program, because disability is not just the wheelchairs and so forth. We work with the other chronic diseases in terms of rehabilitating stroke patients and so forth. And also they have a program at the university in terms of training. They can do further training at the University of Guyana. So we'll continue capacity building as well.
The construction of the Training Center for the Treatment of Physical Disability at the Cyril Porter College of Education, Turkana, is expected to commence in 2017.
Shortly, that tripartite agreement we have with CARICOM, the Cuban government, and the government of Guyana, with the institution that is being right now at the Cyril Porter College of Education compound, would come into force, and we will start training trainers at that institution.
The center will be fully equipped to train local and Caribbean psychotherapists in an effort to provide quality health care to persons with disabilities. Meanwhile, other centers for rehabilitating patients and persons with disabilities include the David Rose School for Special Needs Children and the Tommy Reed Rehabilitation Center. The latter center was originally established in January 1967 by the Ministry of Health to provide rehabilitative services for children who had suffered residual paralysis following the 1960 and 1964 poliomyelitis epidemic. With control of polio and the subsequent reduction of these types of cases, the center developed into an organization providing comprehensive programs in rehabilitation for children with various types of physical and other developmental disabilities. With the expansion of the orthotic and prosthetic workshop from a small unit catering for the needs of only the children of the center, the facility now has the potential to manufacture almost any application that may be required by persons with physical disabilities. Vocational rehabilitation was introduced, and in 1998 the center implemented its audiology service for persons with hearing impairments. Additionally, the center collaborated with the Guyana Green Heart Society to offer accommodation for their therapy center for autistic children. The center is capable of providing services for up to 30 residents, while the outpatient clinics register in excess of 100 new patients annually. To this end, capital expenditure for 2017 for the Disability and Rehabilitative Program caters for the purchase of vehicles. Money has been set aside for the purchase of a pickup and a 15-seater bus, equipment such as treadmills, epileptical trainers, therapeutical bicycles, and weight bars, along with massage tables. Additionally, $6 million will be used to purchase medical equipment such as neurology bed, audiometers, auditory brainstream response machine, and echo check screeners. With new treatment care facilities and the strengthening of health provision units through capacity building exercises, all components of the Public Health Ministry are expected to provide optimal health care in 2017. Citizens will experience a good life through better health in maternal and child health, eye and oral health care, new treatment care, and disability and rehabilitative services as needed. As a result of the Government of Guyana's interventions into the public health care system's services, will be more accessible, acceptable, affordable, timely, and appropriate. 2017 promises efficient and effective health care delivery in keeping with the government's mission through the Ministry of Public Health to enhance the effectiveness of health personnel through continuing education, training, and management systems. With that, we have come to the end of this edition of Guyana's 411. Thank you very much for joining us, and do have a safe and productive week. I am Gabriella Patram.